Clogged arteries, medically called atherosclerosis, is the leading cause of death worldwide. It causes heart attacks, strokes, and sudden cardiac death. And it's often completely silent until it's too late. But there are 5 warning signs your body sends when your arteries are dangerously blocked. Today I'm sharing what these signs are, why they happen, and what you must do if you experience them. If you're over 50, this information could save your life. Welcome to Graceful Aging Guide. Atherosclerosis happens when plaque, made of cholesterol, fat, calcium, and other substances, builds up inside your artery walls. Over time, this plaque hardens and narrows your arteries, restricting blood flow to vital organs like your heart, brain, kidneys, and legs. The scariest part? You can have 70% blockage and feel completely normal, but that last 30% can happen suddenly, causing a life-threatening event. These 5 warning signs often appear before that happens. Learn them, watch for them, act on them. 1. Chest pain or pressure, angina. The first and most critical warning sign is chest pain, pressure, tightness, or discomfort, medically called angina. This happens when your heart muscle isn't getting enough oxygen-rich blood because the coronary arteries feeding your heart, are partially blocked. Angina typically feels like pressure, squeezing, heaviness, or tightness in the center or left side of your chest. It can radiate to your shoulders, arms, especially left arm, neck, jaw, or back. It often occurs during physical exertion or emotional stress and goes away with rest. Many people dismiss this as indigestion, muscle strain, or anxiety. But it's your heart telling you it's starving for blood. Critical distinction: angina that's stable, happens predictably with exertion and resolves with rest, is a warning. Angina that's unstable, happens at rest, lasts longer, gets worse, is a medical emergency. Call 911 immediately. Research shows that people who ignore angina symptoms have significantly higher rates of heart attack within months. What to do? If you experience chest pain or pressure, especially with exertion, see a cardiologist immediately. Don't wait. Don't convince yourself it's nothing. You'll need tests like an EKG, stress test, or cardiac catheterization to assess blockages. If caught early, interventions like medication, lifestyle changes, stents, or bypass surgery can prevent heart attack. Never ignore chest symptoms. They're your last warning before crisis. 2. Shortness of breath. The second warning sign is unexplained shortness of breath, especially during activities that didn't used to bother you. When your heart arteries are clogged, your heart can't pump efficiently. This causes fluid to back up into your lungs, making you feel breathless. You might notice you're winded after climbing 1 flight of stairs when you used to handle 3. Or you're gasping after walking a short distance. Or you need to sleep propped up on pillows because lying flat makes breathing difficult. Many people blame this on getting old or being out of shape. But sudden or progressive shortness of breath is a red flag that your heart isn't getting adequate blood flow. This can also indicate heart failure, when your heart muscle is so weakened by lack of blood flow that it can't pump effectively anymore. What to do? If you're experiencing new or worsening shortness of breath, especially with minimal exertion, see your doctor immediately. You may need a chest X-ray, echocardiogram, ultrasound of your heart, or stress test to evaluate heart function and blood flow. Don't dismiss breathlessness as normal aging. It's not. It's a warning that something is wrong with your cardiovascular system. Early intervention, medications like beta blockers, ACE inhibitors, or procedures to open blocked arteries can restore function and prevent progression to heart failure. Leg pain when walking, claudication. The third warning sign is leg pain, cramping or heaviness when walking that goes away with rest, called claudication. This happens when the arteries in your legs are clogged, peripheral artery disease or PAD. When you walk, your leg muscles need more oxygen-rich blood, but the narrowed arteries can't deliver enough, causing pain. The pain typically occurs in your calves, thighs, or buttocks. It starts after walking a certain distance and forces you to stop. After resting a few minutes, the pain goes away and you can walk again, until the pain returns. Many people think this is just muscle soreness or arthritis, but claudication has a distinctive pattern: pain with activity, relief with rest. Here's why this matters. If you have PAD in your legs, You almost certainly have atherosclerosis in other arteries too, including coronary arteries. People with PAD have 4 to 5 times higher risk of heart attack and stroke. What to do? If you have leg pain when walking that improves with rest, see a vascular specialist or cardiologist. You'll need an ankle brachial index test, comparing blood pressure in arms and legs, and possibly an ultrasound or angiogram to assess blockages. Treatment includes medications, antiplatelets, cholesterol-lowering drugs, supervised exercise therapy, and in severe cases, angioplasty or bypass surgery. Don't ignore leg pain. It's warning you that your entire vascular system is at risk. Erectile dysfunction. The fourth warning sign, particularly for men, is erectile dysfunction, or ED. This surprises people, but ED is often an early warning of clogged arteries. The penile arteries are much smaller than coronary arteries, so they get blocked first. ED can appear 3 to 5 years before a heart attack, when blood flow to the penis is restricted due to atherosclerosis. Achieving or maintaining an erection becomes difficult or impossible. Many men are embarrassed and don't mention it to doctors, or they assume it's just aging or stress. But research shows that men with ED have significantly higher rates of coronary artery disease, even when they have no other symptoms. ED is your cardiovascular system's early warning system. If small arteries are blocked, larger arteries, like coronaries, are likely narrowing too. What to do? If you're experiencing new or worsening ED, don't just take erectile dysfunction medications and move on. See a cardiologist for cardiovascular evaluation. You need cholesterol testing, blood pressure assessment, possibly a stress test or cardiac CT scan to check for arterial blockages. Addressing the underlying atherosclerosis through lifestyle changes, medications, and risk factor management not only improves cardiovascular health but often improves erectile function too. ED isn't just a sexual problem, it's a cardiovascular warning. Take it seriously. Stroke symptoms or TAs. The fifth warning sign is transient ischemic attacks, TIAs, mini-strokes, or actual stroke symptoms. TIAs occur when blood flow to part of your brain is temporarily blocked, usually by a clot from atherosclerosis in the carotid arteries, neck arteries feeding the brain. Symptoms include sudden numbness or weakness in face, arm, or leg, especially on one side. Sudden confusion or trouble speaking or understanding speech. Sudden vision problems in one or both eyes. Sudden difficulty walking, dizziness, or loss of balance, and sudden severe headache with no known cause. The critical word is sudden. These symptoms come on quickly, not gradually. With TIAs, symptoms resolve within minutes to hours, so people often dismiss them. I felt weird for a few minutes, but I'm fine now. But TIAs are urgent warnings. 30% of people who have a TIA will have a major stroke within the next year if untreated, many within days or weeks. Even if symptoms resolve, the underlying problem, blocked carotid arteries, remains and is worsening. What to do? If you experience any stroke symptoms, even if they resolve, call 911 or get to an emergency room immediately. You need urgent imaging, CT or MRI of the brain, ultrasound of carotid arteries to identify blockages. You may need medications to prevent clots or surgery, carotid endarterectomy, to remove plaque from narrowed arteries. TIAs are your brain's final warning before a devastating stroke. Don't ignore them. Act immediately. Remember the acronym BE-FAST. Balance loss, eyesight changes, face drooping, arm weakness, speech difficulty. Time to call 911. If you recognize any of these 5 warning signs in yourself, don't wait, don't hope it goes away. See a doctor immediately, preferably a cardiologist. If you recognize any of these 5 warning signs in yourself, don't wait, don't hope it goes away. See a doctor immediately, preferably a cardiologist. You'll need tests, blood work, cholesterol, blood sugar, inflammation markers, EKG and possibly stress test or cardiac catheterization, imaging like CT angiography or ultrasound, and blood pressure and ankle brachial index measurements. Early detection means early intervention. Lifestyle changes, diet, exercise, stress management, quitting smoking, medications, statins, blood pressure drugs, antiplatelets, procedures if needed, stents, angioplasty, bypass surgery. The earlier you catch arterial blockages, the more options you have and the better your outcomes. Clogged arteries are reversible to some degree with aggressive treatment, but only if you act before irreversible damage occurs. The 5 warning signs your arteries are clogged: chest pain or pressure, unexplained shortness of breath, leg pain when walking, erectile dysfunction in men, and TIAs or stroke symptoms. These aren't symptoms to dismiss or ignore. They're your body's urgent warnings that your cardiovascular system is in danger. If this video helped you recognize warning signs you've been ignoring, please give it a thumbs up and share it. You could literally save someone's life. Do you have any of these warning signs? Have you gotten checked? Share in the comments. Subscribe to Graceful Aging Guide for life-saving health information. Your arteries can't speak, but they do send signals. Listen to them.